I warmly welcome all of you on the behalf of Toshi's team. For me personally, it is very encouraging and to see such an overwhelming response from all of you. It's a Sunday and it's a Sunday evening. It's a leisure time, but you people are so passionate, so much dedicated to homeopathy that encourages me a lot personally. Without taking much time, I would like to introduce, and he does not need any introduction, but still, Dr. Pravin Pente. I know him from more than a decade now. He has been dedicated homeopath and very hardworking with a keen knowledge of clinical aspect, with the basic knowledge of classical homeopathy, and founded very much has been grounded very much into all of the aspects of homeopathy. Let's say, be it the Patra Medica part, be it the laboratory part, be it the clinical investigation part. He has a very good hold, and so patients are so happy with him. What more should I say about him? As a human being, also, he's very down, ground to earth, very humble, and very full of passion. Dr. Pravin, without taking much time, I
Yes,
hand over to
yes,
Dr. Pravin Pente and let's start today's evening. Let's learn together, grow together.
yes, yes. This is our basic mission. Learn together and grow together. I really owe him appreciation, and it's always to go like this way. I appreciate you, and you also appreciate me like this way. Right? So, so welcome you all, guys. Welcome you all, dear homeopath, respected, honorable, and one most important thing, the human beings. So welcome you all again. This is Dr. Pravin Pente, a passionate homeopath, a counselor, and life coach. So the ability to observe without evaluating is the highest form of intelligence, right? What it means exactly, will tell you at the end. Once many of my students always used to tell me, Dr. Dear sir, can we arrange a free webinar on pathological cases? Can we arrange a free webinar for your clinical understanding? Can we do something for the new beginners or some practitioners? So I said, okay, I'm trying to do some. And finally, on 6th of March, the day where we are going to take session on art of decoding pathological cases in homeopathy. So why I call it the art, basically, any artist have tools, okay, and with the tools we can make any kind of art. We can make a beautiful portrait, or you can sing a song, you can make a, or you can play a music on that. So along with that, in homeopathy also, while dealing with pathological cases, we also have a few tools, but we must need to know the art, how to use that tools while decoding the pathological cases. It can be a cancer, it can be a gangrene, it can be a uh, uterine problems, it can be juvenile diabetes, it can be a coma, it can be ICU cases. But where there is a pathology is dominating on a body, or where pathology is dominating in a case, that time you must need to know what are the tools which we can use in dealing with this kind of a cases, right? So this is our today's topic, and we have crossed 50 students right now, 50 participants. Welcome you all again. So today I'm going to talk about this, how to decode this kind of cases. Okay. So in the content, we are going to learn one case, and I always feel that case is the only, mediator from which we can learn many things. While just to share a theory, just to share a thesis, or just to share my knowledge without case is not important. I don't feel so. So I always used to go with the cases, and from the cases we can learn many things like repertory, mathematical, clinical knowledge, pathological understanding, and all. So we have a very simple case of a venous ulcer. Along with that, that patient also known case of diabetes, known case of hypertension and thyroid disease, right? Also here into this session, we will see about the significance of diagnosis. Okay, What is the significance of diagnosis while dealing with the pathological cases? I will tell you why this is so much important. Okay. Along with that, we will see about the significance of clinical examination. This is the one of the most important part for any clinician. Okay. Though you are allopath, though you are a homeopath, or you are Ayurveda, but clinical examination must be done by every physician. Okay. They try to understand the investigation. Hmm? This is also important for us. Then, what types of approach we can follow? What types of approach we can go? Okay. IT voice is not clear yet.
Oh, voice is okay.
Voice is okay. Okay, okay. Fine. Some people are telling voice is not clear. So let them. So guys, use your headphone. It will be helpful for us. So what kind of approaches we can use while dealing with the pathological cases? This is also important. So this is always a question in my mind. As I'm practicing since last 15 years, I started my practice at a village level, and I introduced, with Vijay sir's method. Then I went to Dr. Shankaran sir's method. Then I know about the calculator practitioner. So I need to go single dose or multiple doses. Where I need to give more importance only to the sensation or a mind, or directly to the physical generals, or I need to give importance to the one-line symptom of Allen Skinner. Okay, there are different materia medica. There are different repertories in homeopathy. So what to follow, what not to follow, which to consider, which is the important approach while dealing with the pathological cases. So this is the content on which today we are going to talk about. Right. So let's start the case. I'm going to share you a very beautiful case and very simple case, but this case is very critical also. Okay, why is this so? I will tell you. So this is a case of venous ulcer. This case comes to me directly with the venous ulcer, and when this patient came to cabin, he was completely in a pain. Okay, as soon as he entered the cabin, he was continuously, while doing like ah doctor, do something. There is so severe burning in my leg. Doctor, do something. There is so severe burning in my pain. Since night, I was not able to sleep. Okay, constant rubbing on his nearby ulcer, constant rubbing nearby this lesion, we can say ulcer or injury, whatever is there. He was constantly rubbing and constantly he was in pain. He told the doctors, there is so much severe burning pain is going on. Do something, do something. This was the scenario. While asking this happens in my clinic. When patient comes to you directly with the acute or with the severe pathology, you don't have chance to ask something. What happened? What is happening with you? What is the diagnosis? We don't know. So he entered and just you know sit on my examination table. So I said, okay, let me understand. Okay, so on his file, when pathological comes to us, he always comes to with a very big file. So on his file, it is given. It can be a venous ulcer, it can be a diabetic foot, it can be a gangrene, it can be a varicose ulcer. But there was no as such a damn sure diagnosis which was given by any doctor. That was the problem also for me. And one thing I was sure that it is a case of diabetes, hypertension, and hypothyroidism. That guy was so rubbish. He was so healthy, so fat, and it was like he looks like gangster. He's a tick on his head, and he was so much big face, so much big body kind of. And he entered the cabin, do something kind of in the pain. So I asked him, since when you have this problem? So he told me, doctor, I have this problem since 6 years. So I asked him, what happened then? I don't know, doctor. Since night, this burning is going on continuously. So he had taken so many medication where there was no as such relief into the ulcer because his ulcer was still same. Okay, but what was the difference between that? Pain was subsiding and pain again comes. So this was an episode actually. Whenever he used to, do work, then pain starts. Whenever he has rest, then there was no pain. That was the scenario going since last 6 years. And he came to me directly as a new case. Okay, so I was like thinking about so what to do, how to solve this case. There are so many diagnoses: varicose ulcer, gangrene, diabetic foot. This is a Canadian known case of hypertension and thyroidism. So what to consider, what not to consider? How do I decode this case? How to I just need to solve this ulcer? This was the biggest question in front of me, and not only me. It will definitely this question comes to everyone, right? Because suddenly, how can I do something? No, If patient comes in a agony, patient comes in a so severe pain. Okay, so I asked him little bit history, and he told me, doctor, there was a severe pain is going on. Okay, there was throbbing pain, there was severe burning pain. I'm doing rubbing. So I thought, let's examine, let's do the exam. So here I'm going to talk to you about what is the significance of clinical examination. Whenever there is a no, confirmed diagnosis, so you have to diagnose the case. You have to first of all do the clinical examination on yourself. It should be done by any homeopath. Every physician should go with the clinical examination. Okay, why it is so? You know what happened? We just cannot go with the diagnosis with the other people. Okay, so always go and examine the patient. So what I did, I also try to understand, to examine his local portion, the local part of the limb, the right limb, where there was a ulcer. So into that I try to touch it, I try to feel it, but on touching there was so severe pain. Okay, so what we can learn by touching the local part, where we can feel the part is cold, we can also understand the part heat. There can be sensation, there can be a sensitivity on touch, there can be a on tenderness, can be a painlessness, there can be a painful anything. Okay, while dealing with this kind of cases like gangrene, or like we can say ulcers, you must need to understand the edema. Is there a localized edema or it's a generalized edema? Okay, if the person who is working as a police, traffic police, the person who is working as a conductor, they have a long standing job. So these kind of people mostly get ulcers with the generalized edema. So this is also helpful. Why this is helpful, I will tell you. Okay, this is very important to understand. So always palpate the local part. Also, in specially cases of gangrene and diabetic foot, you always need to palpate the pulse. Okay, as we are going to palpate the radial pulse here. Also, we are going to palpate the arterial pulse, arterial artery. The same wise, if there is a ulcer, or is there is a gangrene, or is there a diabetic foot, or is there a decubitus ulcer in diabetic foot, you always need to palpate the pulse. Where we need to palpate the pulse, in between the great toe and second toe. You can feel, you can palpate. If you get a palpate, arterial palpitation, it means blood flow is going. If there is no palpitation, means something is going wrong. Okay, if that injured part, or if that ulcerative or gangrenous part is cold, okay, it means that something is going wrong. Superficially you are feeling that skin is okay, but there must be something necrotic part is going on under the skin. That is very problematic. Okay, so why there is a coldness? Because there is a reducing blood supply. Means there is no arterial blood, there is no oxygen, there is no fresh blood. That's why that part becomes cold. So how to understand this? As we go to the high mountains, as we go to the to the Kashmir and somewhere else in the high mountains, or into the snow places, you can feel that your fingers get sinus, your nails become bluish, and you feel coldness and you feel numbness. So whenever there is a coldness followed by painlessness, that is really problematic in this kind of a patient. So I'm talking about especially for these patients. Okay, and if there is a chronic ulcer, if there is a decubitus ulcer, if there is a gangrenous ulcer or gangrenous part, always try to understand the smell. Is it offensive or is it not offensive? Okay, is it a bleeding or it's no bleeding? Is there discharge? Is there no discharge? On just lightest touch, is there any bleeding or not? This is very important. Why is this so? If there is an offensiveness into the ulcer, it means that there is infection, there is bacterial infection. Next, there is a debris formation under the of that ulcer. There can be a decomposition of bone or cartilages. This could be happen. So it's very important to understand this kind of. So on this clinical examination, you have to go with this, especially while dealing with the ulcer cases. So I'm giving an example. Why is this so? Now you can see in this picture, the first picture is of diabetic foot. Okay, this diabetic foot is showing you also under the great toe there is the ulcer, which was chronic ulcer. We call it as a decubitus ulcer. It is very indolent and it takes time to get here. Okay, Into the second picture, you can see it is also my patient. In second picture, you can see there is a gangrene. Okay, so first toe and the little finger of that little toe is completely black except middle three fingers. Okay, so in these cases of gangrene, you will not get the pulsation at that the foot, and the foot becomes completely cold. There is no sensation, there is no pain because it's a dry gangrene, it's not a wet gangrene. There are types of gangrene. No, there are three types of gangrene which are we have learned in pathology. There are three types of gangrene: gas gangrene, wet gangrene, and dry gangrene. So mostly into the dry gangrene, you will not get that kind of a smell. You will get completely dry part. Into the wet gangrene, you will get smelly, offensive smell. There is a discharge, greenish sort of a bloody into the wet gangrene. See another part. It's a cellulitis, okay, but it also look like ulcer. But into the cellulitis, see that there is a generalized to the local part, not just to the edema only. Okay, so like this way, you must understand what is the significance of clinical information. You must need to go with this. So come to the point in my case. Into the case, as he came with the severe burning pain and there was so much rubbing, on examination, everything was normal. There was nothing kind of a coldness or nothing, any kind of a problematic into on examination. There was a pulsation, there was a pain on touch. It was completely there. So I feel that there is no access sign which leads towards the gangrene or which leads towards the venous ulcer or which leads towards the varicose ulcer. It was not like that. I thought it was something different what they many people give the diagnosis, no, what they came with the file. But in investigation, except the blood, all reports are normal. He did, color Doppler, he did many blood investigation, all was normal, nothing was there, blood flow was normal, everything was normal except WBC. His WBC was high and eosinophilia was high. So why is there at mucous membrane or when there is infection at the skin level, use always high, even though CRP always go high. If chronic infection, so I thought this is something else. This is not a gangrene. This is not that doctor diagnosed it with the question mark. So every homeopath should have a faith on him, have a belief on himself to diagnose the case. So on that day, I diagnosed that it's just the unhealed ulcer. ये ulcer है अभी तक बैठा नहीं है. That's it. So I do that. But it was not a venous ulcer. I was confirmedly that it was not a venous ulcer. So what I did, I asked him few questions. Ask him into the case checking, let me know from where you have this problem. So he told me, doctor, I got accident in 2011 before 6 years back. So I said, then okay. So he told that time I fell down on the road and my leg was on silencer. That right leg was touched on the silencer, and since then there was an injury. And that injury or that burn part was very difficult to heal. It took so many days to get healed. I took so many medications. I did so many things, but till today it was not able to get completely healed. I said, okay. Then later on, after 2 years or 3 years, doctor told me that it turns to the ulcer. Now it becomes an ulcer. Be a gangrenous ulcer or it can be a venous ulcer, as per the doctor. So I asked him why and when this problem starts. Doctor, he said, I am a shopkeeper. I have to stand at least 12 hours a day. So I said, then okay. So at the morning I was okay always, but at the night and the evening the burning pain starts. Okay, which was his scenario. It was always going on off. Weekly, twice or thrice he used to get this episode of burning pain nearby the ulcer, and he was whole night he was like do rubbing around us, rubbing like this. Scenario going on. And somebody to go to Dr. Pente, he will do something for this kind of cases. So he came to me, right? But before 2 days back, he visited a doctor who was an orthopedician, and he advised him to go for amputation, because if this is not going to help you how to get heal this ulcer, you need to go for amputation. And along with that, patient told me, doctor, just do something for this burning pain. Give me some medicine urgently. I'm not able to tolerate this. Just do something. And there was a repetition of only one thing: burning pain, burning pain, burning pain, pain, burning pain, intolerable pain, burning pain. So I thought, let's enter the case with the pain. Let's elaborate the pain. Let's explore the pain. Okay, because this is going on since 6 years, and these episodes were coming last in 6 years. The character of the pain is same. That is severe burning pain. I said, okay, let me know what is happening. Tell me something about burning pain. So what he told me that he told me this burning pain is like doctor as if a pepper powder. किसी ने मेरे पैर पे मिर्च का powder डाल दिया, you know. So on my own, as if there is a pepper powder and severe burning pain is going on. He was doing like this and continuously he was rubbing. This was a gesture. He was doing like this. So I asked him when this pain aggravates when this ambulance. He told doctor whole table for I was standing work in my grocery shop and at night I get a severe burning pain, doctor. I just could not walk, I just could not touch the around the injury or on to the it was so severe. I said then okay, what else? What makes you amelioration with the cold water, with cold application? I said, no, nothing. It's superficial massage you made. I used to this for 8 hours, 6 hours at night, and tomorrow morning and again need to go for my job, my my grocery shop. And hello, okay, fine. So in the question, there was a constant rubbing. There was a hard rubbing around us. Okay, and also you can also see the in the picture there is just watery. There is no so much bleeding. There is no debris. There is no formation. So observation always plays an important role in while dealing with the pathological case. It can be a patient comes with the mouth cancer. It's the squamous cell carcinoma or something else. Okay, I just wanted to tell you my failure. Just wanted to just I just remind that share. One of the case came also with me with the cancer of mouth, and I thought that it can be a squamous cell carcinoma. But later on, this patient I just could not able diagnose it properly, and I went some in the rubric that case was bad and he went somewhere else. I always used to ask the patient, what happened next? What happened next? But that case was a cancer of, parotid gland, not a squamous cell carcinoma. Okay. So these things happen. So always observe the case, observe the local part, always the local injury. This is very, very important, right? So into this patient, into the local part, there was no offensive smell. Okay. So what it means, if there is no offensive smell, what it means, why he get aggravation on standing, what it means, why there is a burning pain in ulcer and emulsion by rubbing, what it means. So these are the answers for you. Okay. Anybody knows if there is no offensive smell, what it means? You can why he gets aggression only on standing, what it means, why there is only burning pain in ulcer, and he get amelioration by rubbing, what it means. This is very important. See, I am not here to present everything. No, I'm not here to just present. I'm here to interact with you. You must also need to have an answer. You must need to have that query. You must need to have that thought. अरे ये क्यों नहीं है? Right? Why there is your only burning pain? Why not throbbing pain? Right? Why not lightning pain? This is also important. Yes. No spreaded infection, Tamanna Kasna. Yes. No infection, Harshita Hori. Very good. No pus. Absolutely right. So if there is no offensive smell, means there is no necrosis, means there is no bacterial infection, means there is no infection as such. But now second question, why there is a burning pain on standing? Why burning pain on standing? Yes, Dr. Manisha, right? So we'll tell you why there is a burning pain on standing, because there is only venous flow on the limbs. There is no, calf pumping. There is no reverse flow of the blood towards the heart. So that's why there is only venous flow into the calf or into the lower limb. That's why there is only burning pain. Okay, so what it means, whenever there is a reduced oxygen flow to the injury, it burns. If there is an increased blood flow to the arterial flow to the that part, there is no burning. Okay, and why he get amelioration by burning? Why he get amelioration by little hard massage around the ulcer? Because it helps to reduce the venous flow and increase the arterial flow at vascular level, at vascular circulation. This is very important to understand what I'm telling you. Okay, so symptoms, clinical symptoms or disease symptoms never comes directly. There is a process. There is a some there is some process. There is some reason behind it. You must need to understand. Okay, so these are the answer for this. What next? So in this case, which approach we should follow? How to go with this? This big question, man. As I am practicing since last 15 years, I have collected all this knowledge. I have grown up on my own mistakes, on my own going to share. So kind of a path. This is the question. Pathological approach, I should go with the symptoms approach, I should go with the clinical approach. Am I audible? IT?
Yes, doctor.
Okay, fine. So I should go with the organ specific approach, or I should go with the disease specific approach, or I should go with the sensation approach, or I need to give more importance to the only mentals, or I should take only that chiropractor to be fast, or I should take the agony, or I should take the anguishness. What to follow, what to consider, which approach, you know? So today we are going to talk about this, how to decode this case, how to decode this kind of a pathological case, right? But what is important, whatever the approach you follow in your in your pathological cases, but there should be one important thing. While taking this approach, or while going with this approach, we must need to know the roadmap. First we need to know the process. One, we must need to know the course. One, we must need to know the journey of the disease. Okay, and along with that, we can go with a systematic totality, or we have a totality, or then we have a portrait, exact picture. So definitely when he came to us with the big files, there was so much diagnosis. I don't feel that somebody asked him what happened before 6 years back. This is the beauty of homeopath. This is the beauty of every homeopath. We always consider the detailed case taking, right? But not only in mental level, we have to take a detailed case taking at each level. Okay, right? So you have to follow the systematic totality, portrait, and the steps during the case taking or dealing with the deep pathological cases, my dear friends. Okay, that don't jump directly on therapeutic base. Don't jump directly only on that, like this is a cancer of esophagus, then go with iris T or a muriatic acid, or it's a cancer of tongue, then go with calicyanata. Not like this way. Take a detailed history, then go with this. Then your case will decide which approach he needs. Your case will decide, your patient will decide which approach he needs. If he is more on mental level or sensation level, you can go with the sensation approach, right? If you have a specific liver cancer, you can go with the organ specific approach, right? If you don't know the diagnosis, you can follow the clinical approach. If you have so many symptoms and very damn sure PQRS symptoms or a genius in the case, go with the symptom approach, right? So this is the way how we can decode the pathological case, right? So what is the importance of this? I will tell you why this is important, because in our Matra Medica or in our repertory, there are exact symptoms. We can say exact rubrics which gives us the hint of a group of remedies. I will tell you how. Okay. So these are the some findings, or these are the some important rubrics which helps us to consider these rubrics while taking only the pathological rubrics. If there is an ulcer and it's a gangrenous, you have 14 remedies, right? This is a rubric. If you have ulcer, if there is offensiveness, we have 20 remedies. So peculiar. If there is ulcer which is offensive, bleeding easily on legs, you have carbogen, pyrogen. But if you have an ulcer and if there is a just on touch severe bleeding, you can go with nitric acid. If there is a warts on touch, there is severe bleeding, you can go also with nitric acid, right? The fitted lower limbs, you have 15 remedies, offensiveness. So this is a very specific rubrics which we can follow, which we can take, we can consider in our repertorial chart. This is why important to know the clinical examination. This is why important to know the diagnosis. Right? Am I right? I'm able to connect with you guys. I hope so. Fine. So this is another part. Ulcers. What is the specific rubric? Phagdenic. What do you mean phagdenic? Anybody knows phagdenic? This is you. I don't feel many of you came across with this rubric, but I have used this rubric many times. Okay. Anybody knows what do you mean the phagnetic? Don't Google, don't Google. Yes. So phagdenic means it's a necrosis. It's a destruction of tissue level. It's a it's a bacterial infection at local area. It's a bacterial infection at ulcer level, and it's become a destructive. It's become a necrosis before the stage of gangrene. This is a specific rubric. What is this? Ulcers phagnetic. Phagdenic. Okay, we have 20 remedies. So if you have a specific localized kind of observation, and on this point, if you are taking the rubrics, then definitely our funnel becomes so close. Our selection of rubrics and our selection of remedy becomes so close, right? So what it means, if you are going to take this kind of a selection of rubrics only on pathological base, our selection of remedy also comes 100% right, and you will definitely going to act. Other than this, what else? Now we come to we are going to come towards our remedy. Towards our case. Specific rubric: gangrene from burns on or gangrenous sore. So here we is not a gangrene. Here we have ulcer by burn. Ulcer by burn by the silencer of motorbike. Right? So now here we have different rubric. Now go to the from first, second, third, fourth, and fifth. Now see the fifth rubric. Gangrene from burns, diabetic. We have only 9 remedies. But my dear friends, in our case, there is a diabetes, but it's not a gangrene. Okay, this is the beauty. No, this is the beauty of how we can decoding the pathological cases. So you can take this kind of a rubric, right? Now again we are coming towards our case. What to give that patient? So in this case, we know the etiology that ulcer was because of burn. Okay, and we have a diagnosis that it's the ulcer due to burn, or we can say it's the unhealed ulcer, but not a venous ulcer, not a gangrene. Never believe on files, believe on yourself. Okay, an observation: there is the thin watery discharge from the ulcer. It was there. Also an observation: he was constantly rubbing him by his hand on the around the ulcer. In the modality, there is a rubbing, aggression by touch, night and walking on standing, burn pain, emulsion by rubbing by hand. Okay. So now, this is my question to all. Into this history, let me know what is the PQRS. Come on, fast. The people who will give me the right answer, I will send you the direct price to at his home. Rubbing emulsion, no. Come on, fast. I have a special gift. Burning pain, it's the entry point. Burning pain, emulsion by rubbing hand. Okay. Yasmin said burning pain. Manisha Kate, standing aggravation, that's the modality. No, ma'am. Ill effects of burn. Arya Gauri. Okay. You are right. This is the etiology. Carried desire to be burning pain, aggression night, ulcer due to remote injury. Okay. Etiology. Okay, fine. I will tell you what is the PQRS, which is very, very important. I always tell to my colleagues, my friends, my students, what is important, never see what is happening above the river. Always try to see what is going on under the river. Because crocodiles never hunt you on the river. They always come from under the river. Okay. So never see that, never consider that what is in front of you. Always think what is there, which is very, very common, but can be at the PQRS. Right? So what is PQRS here? The PQRS is just that ulcer which fails to heal. This is our diagnosis, that ulcer which is not healed since last 6 years, and we have only 5 remedies: arsenic, cantharis, carbolic acid, causticum, and nitricum. And what is the character of pain? Pain is as if from a peeper. Just not the burning. Burning is just the entry point. Burning is just a superficial pain. What kind of a burning? As if from a pepper powder. My dear friends, are you with me? I'm connecting you. I hope so. Oh, that burning is from like a pepper powder. This is most peculiar. Now, what else? This is unhealed ulcer. There is a chronicity of 6 years, man. And how can we consider? How can we left this rubric that burns, skin, fail to heal, or ill effects? Somebody told about it, ill effects. It was a positive effect. Definitely, you're right. Okay. So these are some PQRS. Then how go ahead with this? Then we consider our PQRS, skin burns, fail to heal, or ill effects. Skin ulcers old, skin pain, burning, smarting, touch on. That is modality. Skin pain, burning, smarting, night. That is also modality. Generality is pain, burning, smarting, pepper as form. This is a rubric which is given exactly what he told us. Pepper powder as its form. Generality is pain, rubbing, massage, amelioration. This is also a exact observation what we have get in the case. Then skin ulcers discharge suppurating water. Thin suppurative water. There is no blood, there is no pus formation, there is little bit debris, but mostly discharge of water. These are the 7 rubrics we have. On this point, if we go with the repertoire chart like this way, and if we think so, these are the codes: diagnosis, etiology, modality, character of pain, observation. If we go like this way, we have these 3 to 4 remedies: causticum, arsenic, one of the most important remedy, merc salt, also carbovage because of burning, arsenic, which is a very important remedy for gangrene, and also the cases of, we can say, for the cases of ulcers, right? So what to do now? Which remedy we can consider? How to go with this? Let me know. Okay, we'll tell you. So now come to the point of analysis and understanding of selection of remedy, not the analysis and understanding of the case. We have covered it. So today I'm going to teach you something very, very important. Just never believe on the repertoire chart. Just never go with the repertoire chart, my dear friend. Always do the analysis and understanding of selection of remedies also. Can we go with the causticum? Can we go with the arsenic? Can we go with the mercol? No? Or can we go with the cantharis also? Or can we go with the meserium? Because meserium considers mostly the ulcers on the joints or ulcers on the bones, sharp bones. Okay, so this is also important. So what to do now? Before going to come to the remedy, I'm going to show you the follow-up, right? So those are not from Maharashtra. For them, here is the transcription. I'm going to play the video. Okay, whatever he told, it is written on the PPT.
पायाला त्रास कमी आहे बुवा सध्या.
पायाचा त्रास सध्या नाहीये. Is it audible?
ते काय झालं होतं नक्की?
जखम झाली होती.
थोडं जोरात बोलता येईल का?
Is it audible? IT?
जखम झाली होती.
कशाची जखम?
Yes, yes.
Okay. So there was the injury.
बऱ्याच वेळा दवाखाना केला, आराम नाही पडला.
हा.
तुमच्याकडे आल्यानंतर आराम पडला.
नाही ते त्रास काय होतो त्याच्यामध्ये?
अंगार पुष्कळ होत त्याच्यामध्ये.
अंगार?
हा.
कशी अंगार होती ते?
असं गरम जळत
So severe burning.
अंगार झाले.
आणि काय केल्याने बरं होत होतं मग ते?
ते काही नाही बस असं सल्ल्याने बरं वाटत होतं तेवढं.
सल्ल्याने करून दाखवा. सल्ल्याने
So he was showing us.
हात फिरवला की
By rubbing, I feel better.
असं फिरवलं की बरं वाटत.
बरं वाटत.
अच्छा. आणि ते कसं काय जळलं होतं बरं?
ते सायलेन्सर.
It was burned because of silencer.
5 वर्ष झाले त्याला.
Before 5 to 6 years back.
सायलेन्सर.
तिथं कसं लागलं चटका?
गाडी जसं टेबल सीट होतं आम्ही.
हां.
नागरडी टाकली होती.
हां.
गाडी स्लिप झाली.
My bike gets slipped.
जळलं मग 15 दिवसानं उमळली.
My burning.
बरं, मग डॉक्टर काय म्हणाल तुम्हाला?
डॉक्टरचं काय औषध गोळ्या बऱ्याच ठिकाणी घेतल्या, पण आपल्याला आराम नाही झाला.
जेव्हा आग झाली की काय करत होते तुम्ही?
बस असं त्याला हात फिरवायचा.
कमी वाटत होतं, पण काय
What
वाटत
was the feeling inside while burning pain?
आग झाल्यावर जीव कसा करत होता?
Experience.
झोप नव्हती येत मला.
Was a sleepless night.
कसा त्रास?
पुष्कळ त्रास. सांगू नाही शकत.
I can't express the pain.
आता कसं आहे ना?
The wife is saying it's okay.
म्हणजे हे औषध घेतल्याने तुमच्याकडे तेव्हापासून म्हणजे बराच तब्येतीला आराम आहे. इथं असं जीव घाबरल्यासारखं.
काहीच नाही. तेव्हा.
झोपत पण नव्हते ते.
नाही का? मला वाटतं आपण ऑगस्ट महिन्यात बसलं का हे आपलं?
Fine.
हो. 15
So this was his follow-up, and on the follow-up, later on, see the changes in his life. The first day on consultation, okay. Second day, just after 10 days. Then near about after 3 weeks, and just after 1 month and 4 days. 19 July 2017. So this is the potential of homeopathy. I would like to tell you. Okay. It's not a magic. I never consider that it's a magic. It's a scientific reason. There's a science in homeopathy, but definitely it depends on the person or a physician how artistically he's using that tools to decode the pathological case. So this is the ulcer of 6 years, and now he just get healed with only with the 1 month and 4 days. How is it possible? It is possible. Okay, if you go scientifically, if you go with this kind of like diagnosis, investigation, clinical examination, if you understand what is happening behind the reason for this ulcer, what is exactly going below the river, once you consider, so understand, it's very important. So what is important to know about this burning, this anil ulcer, this about it. So why it's very important. So why it takes so much time to get healed is because of disturbance in the osmosis regulation, disturbance in sodium potassium channels, in sodium potassium nutrient channels at the mucous membrane level. There is a disturbance in diffusion and osmosis, and this is the reason because of what there is no healing of that mucous membrane, healing of that superficial skin, and that's why there is severe burning. If you know that, if we have a cases of senile neuropathy or diabetic neuropathy, patient always complains about burning in soles and palms. Why is this so? Because there is always a reduce of sodium and potassium. Also in the senile senile neuropathy, old age people, they always have a burning sensation in the soles and palms because of disturbances in sodium potassium channel. Okay, so we need a remedy where there is an importance of sodium potassium channel, right? So on this point, we gave that patient remedies causticum, and then what causticum contain is a potash. What is the importance of potassium carbonate or a potash into the burning cases? Anybody knows? We'll tell you. Okay. So if the burning case comes to you, there is a bandage of potassium carbonate or the potassium. They used to put this bandage on the skin burn areas or the burning part of into the on patients areas where there is a burn. If you have done a duty or visited the burn ward, you will get the patients with that bandage of potassium carbonate or potassium. That helps to heal the mucous membrane. That helps to heal to recover that mucous membrane. It helps. It's very important. Okay, so we gave him causticum into the repetition. Okay, and after that we get this result. On August, he was completely better. After 2 months, I think we have taken his follow-up on 17th of July, and on after that on August 10th, he was completely okay. Now see the fresh skin, there is a shiny skin. Okay, now there is no pain. He was doing work very well. He's going to his job. So if you think of another angle, like what is his most important part? He has to go for a job daily. So he was struggling for his bread and butter. Another thing, he was struggling for his routine work. Okay, so issue of job, issue of money, issue of routine work. Okay, so these also helps us to understand we need to select the remedy from the rope. And Kali line is only for that. Routinism, routine work, maintaining routine, relationships, money, job, health. This is the problem with going on with this. So this causticum did the result, best result with this kind of question. So what is the references from the Mater Medica? If you go to the clinical Mater Medica of Patak, it is given. There is a progressive loss of muscular strength. There is the ill effects of burn and scars. Okay, there is the ulcers malted with the lead. Okay, the lead means a chronic cause. Okay, so it's exactly given in Mater Medica. So just we are not depend only on rubrics. Are you with me? If you go to the if you go to the mind section of any repertory and try to find out, nervousness, restlessness with the severe burning, also you will get caustic. There is I remember there is one single rubric of causticum that ulcer or the burning pain aggravates in damp cold weather. This is also caustic. Okay. So if you try to understand causticum at this way, like this way, you can go and find out many rubrics you will get which is related to the skin healing or mucous membrane healing, which is related to the burn. What is the cause for mostly the burning? I have a case of keloid. That keloid was because of burn, but that keloid was get healed with the causticum only, not because of silica or not because of puja or not because of any other remedy. So whenever this is the cause of burn or whenever this is ulcer or keloids or anything because of burn, always go with the caustic. Now, what is the dilemma? We know the burning pain with the burns, always go with the apis mellifica or cancerous, right? Or arsenic, right? Am I right? But this is not a way. We need to explore our own knowledge. Never listen anyone. Always follow your own knowledge. Always go in details. Always try to understand the reference work. It is given into that book. No, don't go like this. If I am going to tell you something, don't follow me. Do your own study. Go to that part. Find out exactly what is there, what is not there. Okay. So this is the way how we can go. Just a minute. Am I audible? Yeah. So, IT, am I audible? Hello.
Yes, yes.
Yes. So in case taking, now we are coming to the most important part. Okay, we are entering into the process. How to enter into the case taking of pathological part. How to decode the pathological cases. So any pathological case when patients comes to you, okay, and if he comes with the pathology, never ask about his nature. If he's telling you about his pathology, go with this, because first 10 minutes is very important in cheap complaint or a presenting complaint. Always consider it. You will get a chance to get an entry point into that. In this case, as we have an entry point of burning pain, right? Then investigate the chief complaint in all the areas, just not only with the local. How you are feeling with the chief complaint, what you consider, what is your experience with the chief complaint, okay? What are the associated symptoms with the chief complaint? What are the concomitant with chief complaint? What are the peculiar modalities with the chief complaint? It is very important. Also, into the repertorial chart, or when you are going to make a systematic repertory or systematic totality of repertory, always consider the factual things, which is the fact. जो दिखता है वो लो, अपना brain use मत करो. Okay, I have shown you the quotes in the first PPT. I will give the answer of this at the end. Okay, so always consider the factual things. Always consider the local level things. Explore local symptoms. Explore the local level symptoms. Explore the modality. Just don't go with the burning pain, because beyond that burning pain, burning like a pepper powder, burning like a red pepper powder. This is also a rubric which is so much peculiar. Okay, if there are significant characteristic symptoms at local level, always consider it. Go into the detail. Try to find out what is there. That is the surest symptoms for you for selection of remedy. Okay, very important. You can take the picture. Now we are coming to the point of regarding this case. How we decode this code first etiology. We have code second. We have code third by clinical examination. We know that it was not a gangrene. Then code fourth modality. We have a typical modality of Pravin. Typical sensation of pepper pitfall. Typical PQRS of unhealed ulcer. There are only 5 remedies. And always consider the clinical remedies. Always consider the clinical books while dealing with the pathological. Okay, because we got this reference exactly in pattern. In Lillian, Harrington, Boric, definitely. Okay, so this is important. Consider this book. Now we are coming to the point about this, about the first quote. The ability to observe without violating the highest form of intelligence means is nothing but an unprejudiced observer. Most of the students, or most of the, even I have also done the same mistake. Most of the time we get prejudiced. Oh, this is a gangrene, or this is a diabetic food. Consider the remedies. Don't go like this. Always examine it. Okay. Then, what is today's learning? What we learn today? We learn about in cases if there is a pathology dominant, then always consider it. Okay. So as we know that I have not considered carry desire to be, I haven't considered about other mental symptoms, because here pathology is important. So if you take the totality of mentals, totality of pathology, totality of modalities, definitely will be causticum there. But while decoding with the pathological cases, we have these 4 tools. I am just mentioning here only 4 tools. We have 10 more 4 tools. We will coming to the next sessions. So go with this now. Go with this like way. Okay. And what is the second part? Take separate totality of each. Mostly in pathological cases, you will get the PQRS, genius facts in first 10 minutes. Believe on that. Consider it. Go with this. Okay. So my dear friends, thank you so much for your joining. This is just a trailer picture abhi baki hai mere dost. Okay. So here on this Sunday, we are just have a single case in detail how to decode the pathological case. To the next Sunday, 10th of April, we are coming with every Sunday on free webinar on pathological decoding. This is the part first. And on the 10th of April, we are coming with the many great homeopaths across the India. Those are practicing daily with 70 to 80 patients per day with severe pathology. Okay. So here I would like to announce on the behalf of Toshi and my team on 10th of April on the birthday of hello IT, am I audible?
Yes.
I'm not able to go ahead with the PPT. What is happening?
Just close PPT and reshare again.
Pardon? Close PPT.
Close PPT and reshare again.
Okay. Share again. Fine. Just a minute. So these are the they are just not the homeopaths. They are the real clinicians. They are practicing their across the India. One of them are from you screen is visual. Is the PPT? I think.
Your screen is visible.
Yeah. So these are the great homeopaths. They are the young, dynamic, passionate homeopaths. They are working only for the patients. Dr. Mani Jakpal is from Ludhiana, one of my big brother and a friend. I will be there on all Sundays. We are coming on every Sunday from 10th April. Then one of my best friend, Dr. Manish Yadav, he's practicing beautifully in cancerous cases. He has been experienced working with many stalwarts, many legendary homeopaths, and he has great clinical knowledge, especially in pathology. So he will be sharing his own knowledge with us. Then my brother like Ranjan Bel sir, he's from Varud. He's passed out from NIH Calcutta, and he's practicing 80 to 90 patients per day, clinically very keen. He's very having good knowledge of observation, practicing selection of remedy only on that point. Another that Dr. Abhishek Joshi, he's also associated with Dr. Farooq Master. Master having very good knowledge of ICU cases, very good knowledge how to deal with the pathological cases. So we are coming with all these young, dynamic, physicians who have a great knowledge of how to deal with the pathological cases. So this will be a great opportunity to all of you guys to come and join this session from 10th of April. No doubt till 10th of April, I will be there with you on every Sunday. Okay, so this is the free webinar for you on every Sunday. I will coming with very beautiful cases. I will tell you how I decoded how I used the codings, artistic tools of modality of other tools to solve the pathological cases, only on pathological rubrics, only on clinical rubrics, only on clinical understanding, only on pathophysiological understanding. Okay, so every patient must need to know about it. Then this is our team. That we have a Dr. Neha, Dr. Annabelle Menezes, who is the head of UK and US in Canada. We have another clinic in Canada. Dr. Ati Motwani and Dr. Mukesh, they both are now also with us. They are really doing good. We have our clinic in Thane also. Okay, so I'm coming on 12th and 13th March in Thane. You can also send your cases, or you can also come there and meet me. You can also have a join my clinic there. They definitely, I can also learn from you, and you also learn from me. So this is the way. Okay, and also share your feedback me on toshi@gmail.com, and this is my WhatsApp number, direct WhatsApp number. You can also send me your feedback, your questions also you can send me. We'll definitely going to address with your questions. I will try to try to give answer for each and every question. Okay, so this is the way basically how I use the way, or how can use the art while dealing with the pathological cases, my dear friends. I hope you understood very well. And here I would like to welcome Dr. Mendesa, who is from Goa. So I hope, sir, I hope you end the session with your understanding, with your experience of this lecture. I would love to welcome you on the behalf of Toshi, and also you are a part of Toshi. So, sir, please welcome. IT, can you unmute Dr. Valerian Mendesa? Just a minute. Must listen. He's a senior most homeopath. He has experience of working with Dr. Nikam, Dr. Shankaran, Dr. many homeopaths. Are you there?
Yes, I'm there. I'm there.
Yes, welcome, sir.
Yeah.
Welcome to our today's webinar.
Yeah. Yes. Thank you very much, Dr. Pravin, for that brilliant presentation. A lot of learning over there. In fact, friends, what you saw today is just a trailer, as he said. It's just a curtain raiser. And one thing I would like to tell is about Dr. Pravin is that he believes that, when you teach, you learn twice. So, whatever he learns from others, he comes and he teaches us in the group. And if we go and teach others, that means we learn twice. And just to sum up what we have learned today, diagnostic and investigations are closely related. It is true that homeopaths are not interested in the label. Label is not so important. But what is important is to understand the process. And Dr. Pravin spends a lot of time and energy reading between the lines, the why of the investigation. So he always says, understand why. Like, for example, now when he explained in this case, the sodium potassium channels and the effect of, potassium carbonate being applied to the burns. So normally we think that it is a disinfectant, but what is it doing at the mucus level? So that he has explained. So he wants us to understand and question ourselves why. And he captures this essence and converts it into rubrics. And these rubrics are strong rubrics because they are objective rubrics. So with this, I think you will continue to be with us. You can join our group. There are many lively discussions that is happening. And Dr. Pravin, in fact, encourages people to ask questions. He says people don't ask questions because they feel that, what if people will laugh? Log kya bolenge? Ye sabse bada rog hai. That is the biggest statement he makes. So he encourages people to, talk as much as possible to clear their doubts, even if it is a foolish statement. You may feel it is foolish, but it may not be a foolish one. So he encourages people to do that. And we look forward to many more sessions. Stay connected with us and kindly send feedback by email and by WhatsApp so that we can know how else we could improve ourselves. Thank you, Dr. Pravin, and thank you everybody for joining us this time.
Yes. Thank you so much. Thanks to everybody. Thanks for joining. And hopefully we'll meet soon on next Sunday with a very beautiful case. Again, here I am Dr. Pravin Pente